Today I'll be assessing a manual muscle test of dorsiflexion. The muscle we're assessing is going to be the anterior tibialis muscle. First, you're going to have your patient perform active range of motion of dorsiflexion. So Matthew, could you go ahead and dorsiflex or point your toes towards you? Good. And relax. Good. And then your stabilizing hand is going to be here on the medial side of the leg. And then your force hand is going to be here applying force down. So go ahead and dorsiflex for me, Matt. Good. And hold here. Good. Hold, hold, hold. Good. Next, I'm going to assess ankle dorsiflexion, active range of motion with a goniometer. Hi, Matt. My name's Ella. I'm a student physical therapist assistant over at Clarkson College. Is it okay if I work with you today?
Mm-hmm.
Awesome. We're going to go ahead and be assessing your active range of motion of your ankle dorsiflexion here, okay? So ankle dorsiflexion means you're going to point your toes up toward your face here, okay? And then here we're going to make sure you add a bolster underneath your patient's knee here and relax. Good, to make sure that you get a proper assessment of the ankle dorsiflexion. And then you're putting gastroc on active insufficiency here. So your axis will be lined up here with the lateral malleolus. Stationary arm will be in line with the fibular head. And then your moving arm is going to be parallel to the fifth metatarsal. Okay. Good. Next I will be assessing ankle plantar flexion, active range of motion with a goniometer. Your patient will be in the long seated position. And then here, your axis will be the lateral malleolus, and the stationary arm will be pointed towards the fibular head, and then your moving arm will be parallel with the fifth metatarsal. And then for plantar flexion, in the relaxed position, let's see. So Matthew has achieved 0 to 40 degrees of plantar flexion in the relaxed position. And then here, Matthew, when you're ready, you're going to go ahead and point your toes down for me. Good. Good. And so there, Matthew got 0 to 66 degrees. And then normal range of motion is 0 to 50 degrees. Okay. Next, we will be assessing gastrocnemius and soleus for a manual muscle test. For this assessment, you will have your patient hold on to a counter or a table and to just allow them for balance and stability. And then for this assessment, if we're going to assess for gastrocnemius, you're going to have your patient do single leg calf raises with the knee in the fully extended position. For a 5 out of 5 is 25 reps, 4 out of 5 is 10 to 24 reps, and less than 10 reps is a 3 out of 5 manual muscle test grade. And 25. Good, so Matthew would be graded with a 5 out of 5 manual muscle test grade for the gastrocnemius. It is also important to remember to make sure that when they are performing these reps that the calcaneus is getting fully off of the ground here. To assess for soleus, now you will have your patient in a slightly, go ahead and bend your knee for me, Matt. Good, and we'll have a slight knee bend to assess here for the soleus. And then the same grades apply. 25 reps is a 5 out of 5. 10 to 24 reps is a 4 out of 5. And less than 10 reps is a 3 out of 5. So Matthew, if you could go ahead and just demonstrate for me what that would look like here. Good, keeping that knee flexed. Good, keep going. And then just making sure down here that calcaneus is clearing the floor. Next, we'll be assessing ankle inversion, active range of motion with a goniometer. Okay, so inversion, Matthew, we're going to have you go ahead and point that big toe in. Okay, good. So with the goniometer, the axis is going to be the midpoint of the malleoli, so in between your medial and lateral malleolus. The stationary arm is going to stay in line here with the tibia. And then your moving arm is going to follow the second ray or the second metatarsal here. Okay. Good. Okay, Matthew, when you're ready, go ahead and go in for me. Good. Good. So Matthew got 0 to 30 degrees of ankle inversion, active range of motion, and then normal is 0 to 35 degrees. Next, I'll be assessing ankle inversion manual muscle test. You can have your patient in the short-seated or long-seated position. The muscles we will be assessing here is the anterior tibialis and the posterior tibialis working together. And then your stabilizing hand is going to be here on the lateral side, and your force hand is going to be here on the medial side of the foot, actively pushing out into eversion. So first have your patient perform active range of motion of inversion. So good, Matthew, pointing your toes in. Excellent, good, and relax. Good, so I'm going to stabilize you here, and go ahead and come in for me again. And I'm going to push you out and don't let me, okay, ready? Good, hold, hold, hold. Next, I will be assessing active range of motion of ankle eversion with a goniometer. So that's going to look like, Matthew, we're going to rotate out here or laterally here. Good. And then for the goniometer, your axis is going to be the midpoint of the malleoli. And then your stationary arm is going to be in line with the tibia. And then your moving arm is going to follow the second ray or the second metatarsal here. Okay, Matthew, when you're ready, go ahead and point out for me. Good. And so Matthew's active range of motion for eversion is 0 to 11 degrees, and then normal range of motion is 0 to 20 degrees. Next, I will be assessing ankle eversion manual muscle test. So it's going to look like where the patient is coming out here. Good. And then you'll have your patient in the short or long seated position. And then the muscles we're assessing is the fibularis or peroneus muscles, which include the fibularis longus, fibularis brevis, and fibularis tertius. So first you're going to have your patient perform active range of motion of eversion. So Matthew, go ahead and come out for me. Good. And then your stabilizing hand is going to be here on the medial side of the lower leg. And then your force hand is going to be on the lateral side of the foot, and then pushing in to inversion. So Matthew, go ahead and evert that foot for me. Good, and then hold here, okay? Good. Hold, hold, hold. Good, and relax. Next, I will be assessing hallux MTP extension active range of motion with the goniometer. So your patient will be in the long seated position with the foot and ankle off of the table. And then your axis will be the first metatarsal or the first MTP joint. And then your stationary arm will follow the first metatarsal here. And then your moving arm will follow the proximal phalanx. Okay. And then Matthew, when you're ready, you're going to go ahead and point that big toe up to the sky for me. Good. And Matthew got 0 to 61 degrees. And normal range of motion is 0 to 70 degrees. Next, I will be assessing hallux extension manual muscle test. You'll have your patient in the long seated position with the foot and ankle hanging off the table. And then the muscle that we will be assessing here is the extensor hallucis longus. Your stabilizing hand will be here at the first metatarsal, and then your force hand will be applying force through the dorsal side of the proximal phalanx of the great toe. Good, so Matthew, go ahead and extend up for me. Good, and hold here. Good, hold, 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 and relax.